first step to hiring an associate physician is that you should review the laws in your state. In my state of Utah, there's a few stipulations. The medical school graduate can only have graduated 3 years prior. Also, the graduates can work in any field. In some states, they're limited to certain specialties like primary care or underserved areas. But in Utah, they can be in any area and any specialty. Additionally, they can only work for 6 years after they obtain their license. And one more thing, they can only be graduates from a U.S. medical school. Again, in some states, you can be international grads, but in Utah, it has to be just U.S. grads. The next thing you're going to want to do is write a job description. Now, this could be any type of job that you're willing to supervise as a physician. As a primary care physician, I wanted someone to work in my clinic for urgent care and also to see primary care patients. But if you're an ophthalmologist, you may want them to do different tasks. If you're an obstetrician, you may want them to work in the hospital with you or to do post-op checks in the clinic. Basically, whatever you want an associate physician to do under your license, you should think about and write in your job description. Your next step is to create a job posting. So for my job posting, it was very short. It just said what I wanted, how long the contract would be, and the specifications that were required under the Utah law. I would not recommend posting salary, but you could also do this. I then posted this job description on several websites. One of them is unmatched-utah. The other thing you might want to do is contact medical schools in your area. It could be easier to have an associate physician work for you that already lives in your area or may have graduated from one of the medical schools in your state. Once you have your specific job description and posting online, you're ready to receive applications. So once your applicants start rolling in, you're going to want to be reviewing these applications and deciding what kind of criteria you want to prioritize for your new hire. You might consider hiring someone who's already been to residency, maybe for 1 year or a portion of a year. You may want to hire a fourth-year medical grad only for some reason, but you will have your pick, I can tell you, of the many, many thousands of people in this country that do want to work as associate physicians. So once you've identified them, I recommend doing interviews, maybe with yourself, of course, and other partners, and also then ranking them on a list to identify who would be the best candidates for your job. Once you've chosen your favored applicant from your applicant pool, you'll want to extend them a job offer complete with a contract. The contracts that I wrote for my associate physicians were very specific. We asked for 1 year, full-time, 40 hours a week, and then we specified what all of their benefits and pay would be. I would recommend paying them at least what they would be getting as a resident if they were in a residency. And they may also need some additional flexibilities such as travel. Hopefully they will be interviewing to other residencies during the year that they're working for you. They may also need moving expenses, of course, healthcare benefits, and other standard things that go in a contract. Once you've officially hired your associate physician, you're going to need to get them licensed. In the state of Utah, our division is called the Division of Professional Licensing, or DOPL. So they have an application online. They have one for MDs, they have one for DOs, and it is for a restricted physician license. In order to even start or complete this application, you're going to need to have a supervisory agreement and a physician, of course, that agrees to be the supervising physician. So the supervisory agreement talks about when and where you're going to supervise the associate physician, what type of chart reviews you might do, and what duties you expect them to do. In my experience, this is almost identical to the supervisory agreement that we do for physician assistants. So it's really quite simple. After you've completed your application for your associate physician, they will need to wait a little while. It can take several weeks or even several months if there's difficulties getting them credentialed through the process. Basically, they have to verify where they went to medical school and where they went to residency if they completed any residency. But once they get their license, you can apply for your DEA. All physicians, even restricted physicians or associate physicians, need to have a DEA number in order to prescribe any medications. There are some limitations in Utah, for example, on scheduled substances. You can only prescribe Schedule 3 through 5 controlled substances. Not every state has this restriction, but in general, most associate physicians can prescribe. They just need their DEA. Currently, the wait time for this is up to 6 to 8 weeks. While you're waiting for the state license and the DEA number for your associate physician, you're going to want to start training them. Any new hire needs to be trained, of course, and it takes several months for them to learn the logistics and the job specifications that you want them to, maybe more, just depending what you want them to do. In our clinic, we did shadowing in clinic for about a month or two, and then they started seeing patients on a slower schedule while we supervised or staffed each patient with them. Of course, this will be different for every physician and every situation. Every physician I talk to about this asks a couple questions. What about billing and credentialing, and what about liability? Well, liability insurance has not been difficult. That was easy to obtain, and it's kind of through the supervisory physician's coverage or policy. Credentialing is not possible in almost every situation, in our current state at least. Credentialing generally requires board certification, and obviously these associate physicians do not have board certification. So in most cases, they will be treated like a resident or a student perhaps, where the claims and work that they do is billed under the name of the supervising physician, who obviously is credentialed under all the insurances that you would need. So I have found employing an associate physician very similar to employing nurse practitioners and physician assistants, which I have done many times over the years. There's just a couple differences that we haven't already gone over. One of them is that they are often actively applying for residencies. They will need letters explaining their pros, cons, all sorts of great things that you can think of about them to help them with their application. And of course, they may need to be doing some traveling during interview season so that they can present their best foot forward to future residency spots. Because although they may work very hard for you and maybe even work a year or more, remember in Utah they can work up to 6 years, these are years that do not count towards any future residency training in the United States. So they will still need to complete a residency in order to be able to be board certified and complete their final education and licensure.